Hi everyone, Dr. Chiam here from Ensoul Medical. So in the previous videos, I talked about why I don't inject the nose with filler anymore. So I thought as a continuation of that, it would be good to just educate you guys out there about which areas in the face when we inject fillers are higher risk areas than others. So to understand why and which areas are high risk areas for injection, we need to understand the anatomy of the face, and in particular we need to understand how and where the arteries run in the face. So the main artery that supplies the superficial part of the face is the facial artery. So the facial artery comes from below the jawline, okay, it comes up towards the surface at the level of the masseter, which is the main chewing muscle. It then runs a winding course up towards the nose, okay, and along the way it gives off some branches and supplies the upper and lower lip. So we call these the labial arteries, okay, and it goes up to the angle of the nose, which is where our nasolabial folds or the laugh lines originate. So this is one of the main danger areas because you can accidentally puncture or inject filler into the artery if you are not careful. And after hitting the corner of the nose, the artery goes up at the side of the nose, okay, towards the angle, the corner of the eye, where we call it the angular artery. And along the way, it gives off branches to supply the nose, both at the tip of the nose as well as along the bridge of the nose, where some of these smaller blood vessels communicate with blood vessels coming from the other side, the other facial artery. So this is an important area because at the angle of the eye, the facial artery actually communicates with another artery that's coming out deep from the eye socket. Okay, we call this the supratrochlear artery. Okay, and the supratrochlear artery actually continues up this way to supply the forehead. Okay, we also have another artery here called the supraorbital artery that comes up this way to supply the forehead as well. So this area, the forehead area as well as the nose bridge area, is the next danger area that we need to be very careful when we inject patients with fillers, because any accidental injection of filler into the blood vessels can possibly reflux and go into the deep circulation. This is where we have patients who cause blindness as a result of fillers. So of course the next danger area is the nose bridge as well. As you can see, there are many blood vessels in this area. So if we are injecting filler into the nose bridge to try to lift up the nose bridge, any accidental injection of the filler material into the blood vessel can potentially cause blockage of the blood vessel, and when the blood supply of the skin is cut off as a result of the blockage, it can cause ulceration as well as skin changes to the area. So I hope that has given you an overview of why certain areas are higher risk than others, and why sometimes your doctor may be reluctant to inject in a particular area compared to other safer areas. So if you have any further questions, do drop us an email or drop into the clinic and we can tell a little bit more about the injections.